From McCormick Place in Chicago, Illinois, this is the ASN Kidney Week 2016 podcast, a discussion of the latest scientific and clinical advances presented at this year's annual meeting. ASN thanks OPKO Renal for its support of this podcast.
Good afternoon from the second day of Kidney Week. My name is Zent. I'm the program chair of this year's ASN meeting.
I'm Stephen Cheng. I'm from Washington University. I'm an associate professor there and the training program director there.
And I'm Janos Peti-Peterdi, coming from Los Angeles, from the University of Southern California, professor of physiology, biophysics, and medicine.
So today has been another great day at Kidney Week with outstanding talks. It was kicked off this morning by an excellent talk by Kevin Tracy, where he introduced the nephrology folks to a new concept in nephrology, one where you can have neurostimulation regulating the immune system. It was really an exciting talk. I had a lot of people interested and excited about it. In fact, I had to wait half an hour to thank him for giving his talk. There were so many questions, and I think it was really provocative to a lot of the participants here because it's the first time they've heard about this phenomenon, certainly in the kidney world, although he did share some information with us from one of our own members, Dr. Akuza, where he showed that this works in a kidney model of acute kidney injury. So that was a pretty nice way to start off the day.
One of the things that I thought was so interesting is that all of these state-of-the-art lectures have been so, in a way, out of the box for us. So they've introduced new things that I, at least, have never thought about, although I'm not a basic scientist, but I thought it was also very exciting to hear that talk this morning.
Yeah, so one of the things that I spent a lot of time thinking about in putting the program together was, who is our audience at the ASN? And you can choose to go into your pet topics, or you can really make the meeting one for most of the people who come here. And when you look at the 13,000 odd people who come to ASN, most of them are practicing nephrologists and good scientists. And so what we've tried to do is make this meeting very thematic. The theme of the meeting has been diabetes, obesity, and chronic kidney disease, because that affects most of the people. And so the plenary sessions have all been directed around that theme. So yesterday we heard about mechanisms of obesity. Today we heard about a new way to look at inflammation, which is clearly important for the initiation and progression of kidney disease. Tomorrow we're going to have a speaker, Ross Kagan, and he's going to carry on with this theme, which is going to be diabetic nephropathy, once again, out of the box. He uses fruit flies, and he's developed a model of diabetic nephropathy in fruit flies, and he uses a phenotypic screen for drug discovery, so looking at drugs or trying to discover drugs that will reverse diabetic nephropathy. And then on day 4, the plenary speaker is also going to be on the same theme, which is developing new drugs to treat type 2 diabetes. And so we're going to have Dan Drucker here, who has brought the GLP-1 inhibitors, actually did most of the basic science around them and brought them to market. So that's been one of the themes of the meeting, and I think it's been quite successful, and I hope that people have enjoyed it.
Absolutely, and me as a basic scientist at ASN, my priorities mainly have been to look and emphasize the basic science research, both at the poster sessions as well as in the afternoon symposia. And we've had amazing poster presentations on electrolyte and fluid transport and regulation of these events on classic pathways such as the renin-angiotensin system. What is most exciting is that the application of these traditional pathways and mechanisms on new or newly recognized and emphasized processes such as tissue remodeling in the kidney, and combined with traditional topics as blood pressure control and damage and inflammation. So those have been excellent, and we have some more symposia in the afternoon focusing on the distal nephron and the relevance of the salt pinch controlling our kidneys and the whole organism. And also on the technology side, interested in imaging. We have seen many exciting posters this morning on imaging different cell types, unusual non-traditional cell types in the kidney, such as the parietal epithelial cells in the Bowman's capsule, renin cells, and different proximal and distal tubular cell types. Looking inside these cells, evaluate mitochondrial metabolic rate, superoxide production, and also their relevance to other processes, pathogenic as well as protective mechanisms in different disease environment and injury models.
So, once again, Janos has mentioned imaging. So another thing that we did this year, in fact, it was a follow-up from last year. He was the Young Investigator Award and is a master at imaging. And there was a session last year bringing, the state-of-the-art imaging to the ASN. And this year we continued it, actually going to electron microscopy. And we had two absolutely outstanding talks. One of them by Gerd Waltz. He's at the Rockefeller now, and he's been one of the pioneers of cryo-EM, which is a really powerful technique. And people are getting molecular structures down to 1.5 to 3 angstroms using electron microscopy. And he showed people how they're doing that and the technological breakthroughs with that. And then the other talk was by actually a nephrologist, a young woman called Rachel Lennon from Manchester. And she was also talking about how you can use EM tomography now to do sections through whole blocks of kidney and do 3D reconstruction. And I think it was really appreciated. In fact, there was standing room only. And I think that's a pretty big feat for something that's as technical as that. So it was really very, very successful, and both talks were outstanding.
And of course, the imaging topic and the theme will continue for the remaining days of ASN. There will be several sessions tomorrow. One of them will be a classic topic of imaging podocyte cell biology and molecular biology. And we will see several imaging applications there, as well as on Sunday. Hopefully this will help people to stay longer at the meeting. I understand the weather is turning cold, and that will keep people inside. So there'll be a nice imaging session at 10 a.m. Sunday, imaging kidney pathology in vivo, and the application of intravital imaging on imaging kidney fibrosis, inflammation, hypoxia, and ischemia, and so on.
I think one of the cool things about emphasizing not only these sort of cutting-edge new things, but also in supporting the young investigators who are researching these things, is just giving the population a sense of, the ASN cares deeply about cutting-edge things, and really making it a focus for those who want to do renal research and who want to invest in this kind of thing in the future. There's all this talk about decreasing interest in people who are going into nephrology and interested in the research part of it. But things like this, or this morning when they talked about the ASNs securing the future, that movement they're making, I think things like that really give the world notice that the ASN really cares about these things, and we want to support young investigators who are coming up with these really interesting and cool ideas.
Yeah, I think it's really important. I think, as Ray Harris talked about yesterday in the President's address, nephrology is at an interesting period of development, as is basic science. I think there are a lot of things that are going to make it hard to do basic science in this country in every respect, and the society cares deeply about this, and we're lucky that they do, because as a specialty, as he showed yesterday, we're very underfunded. There are not as many young people interested in science as there probably should be. I think we got to think about who's going to be the world leaders in this, and if we want it to be in North America, it has to be funded, and we can't just count on the government to do that. So I think it's really important that the ASN has made this one of its missions, and they do this both by giving out grants and things, but also making sure that it's one of the main reasons why you want to come to this meeting. It's not just a clinical care meeting, and it's not just a patient advocacy meeting. It's a meeting which is based on the best science in nephrology, and I think that really needs to be maintained, and hopefully we've done that in this program this year.
One thing that I really appreciate as a program director is that you guys in the planning committee gave the fellows a chance to shine. There's so much talk about the state of nephrology fellowships and people not necessarily thinking it's a very desirable specialty, that sometimes we lose how important it is to really appreciate the people who are our fellows now and who are in training. And so, speaking about day two and the things that we were excited about, today we had the Fellows in Training Bowl, the Fit Bowl, which is a great chance that we had to sort of showcase our fellows and go through some clinical cases and have them kind of show off some of their knowledge. And it was a really fun session. It was a good way for our fellows to kind of boost morale, give them a chance to show off, and really encourage that side of things.
Yeah, once again, I think that the time has come for us to get rid of a lot of the negativism that comes around nephrology. You go to grand rounds at a university and it's, how bad dialysis patients do, how the problem's getting worse, And we're really bad as a profession in terms of talking about, the great things that nephrology's done. We're still the only specialty out there that can actually reconstitute an organ with something outside the body that's life-saving. We did the first transplant. It's still the most transplanted organ with the best results. We've done some great things, and I think it's hurt the profession in a way, because it stopped us thinking about how to cure kidney diseases, because we thought, well, we could just reconstitute the organ in a machine. And I think the time has come for nephrology to think about where it wants to go in the future. And I think that's the challenge, but also the excitement. But also we need to demonstrate to the world that it's not a dead subject and it's not all depressing. We've done some really great things, and we just need to build on them.
And absolutely, if I may add to what Roy already mentioned, and the importance of basic science and the basic science research. Again, that's my background, and I think it's really important and to encourage the young generation to come to the kidney field. There's a lot of excitement going on. We have a lot to do, but we are doing these things, and also not just for the basic research scientists, but also for the physician scientists to come to this area and stay in this field, which is, again, very important. And firmly believe that that basic science understanding of kidney function is really critical to better understand the disease environment. And we need to encourage both basic scientists and physician scientists to, again, come and stay in this area, which will hopefully provide soon a breakthrough in this devastating disease.
And I think even for those who, like myself, occupy that niche in the nephrology ecology of being clinician educators, I think it's hugely important to really emphasize how important and groundbreaking the basic science part of it, because eventually that is going to translate down the line, and we are going to end up taking all those breakthroughs, because we can't really apply clinical care without understanding those basic mechanisms. We always have to go back and think of how do things work, what are the disease mechanisms, and then apply that clinically. So even for us, I think this is a very exciting time.
Yeah, and I think, the other thing is we need to rethink the definition of basic science. Information technology is growing at a rapid rate. Soon things like podcasts and cell phones and Twitter and all of these things are going to collect far more information about what we do and how we can change our lifestyles in terms of health and wellness. And you add that to, the plethora of data that's coming from gene chip analysis, et cetera, et cetera. What's great, we gather the data. The question is how do you use the data? And I think this is a science that's in its infancy. And that's something that we really need to think about and work on, because it's part of the future. And I think that's another area that nephrology really needs to think about. How do we deal with big data? Having it is not enough. It's how you look at it, how you can get useful information out of it, and what you do with that useful information to transform it. I mean, when you look at big companies like Amazon.com or Walmart, you can go onto a website and they will tell you how much they've got of X product in which shelf, in which place in the country. We need to start doing that in biology better, and doing it in a way that it's shareable, and doing it in a way that we can figure out how to make the lives of people with kidney disease, or just learning the knowledge about kidney disease better. And I think that's going to be one of the big challenges.
It's interesting. There's a session actually going on right now on sort of using some of this new technology in sort of a very different way than what you were describing, but using it in medical education and in teaching nephrology. And there are things out there now like ASN being on Twitter and having webcasts and things like that. So there's a session going on now on sort of the art and science of teaching that is interesting, because it really does start to pull in some of these new technologies of this day and age that are a little bit weird and unusual, like Twitter and social media and things like that, and leveraging that technology towards new mechanisms of education or disseminating information or attracting people to the field, and sort of a cool thing that we've been able to do.
Yeah, I think, we, as Ray Harris said, we need to reinvent ourselves. And I think, in the 1960s, nephrology was the leader in terms of biomedical research, when physiology was really where it was at. And I think the time has come for us to rethink about how we can be at that interface again. And I think this is one of those areas that we really need to work on, because it's going to be huge, especially when you think about the complex physiology of the kidney. You know, the sorts of things Janos does. You do them in a snippet of time and you show a one-off. Now with computation, you can take lots of this information and put it into models to try to figure out how it works actually in real time in whole organisms rather than just in cells or specific receptors and in whole populations. I think it's really exciting.
And if I may add to the big data development, and of course clearly that's the direction on every single discipline and scientific field, and it's definitely true in the kidney to better understand disease and protective mechanisms as well, but only if we interpret this in the right way and put this together with, again, the very basic renal physiological knowledge, understand the function of certain cell types and their interactions, and I believe that's the only way to finally understand the very, very complex mechanisms in disease and translate it ultimately to the therapy.
You know, I hope that those of you who are here in Chicago, you come back to the meeting tomorrow. Got an exciting day lined up, starting off with the fly guy in the morning, who I can assure you will give a very, very interesting talk, even if you don't think flies are that cool. It's really interesting technology. You know, we haven't had a drug that's really changed nephrology in a long time, other than by accident the SGLT2 inhibitors, which have come along. And I think the challenge is for us to figure out how to get new methodologies and new drugs to treat kidney disease. So this could be an exciting talk to see how people think about these things and think outside of the box. And as I say, on Sunday with the same theme, there'll be somebody there who will show you how it can be done in other fields, and we should try to emulate that. So I hope to see you all back here tomorrow and Sunday.
We're all looking forward to it.
Yes.
You have been listening to the ASN Kidney Week 2016 podcast. Support for the Kidney Week podcast is provided by OPKO Renal. This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.